release that shoulder. There we go. Nice job. Good. Nice job.
Yeah, the Nima.
Hey everybody, I'm Dr. Luke Stringer here down at Advanced Health Chiropractic down in south of Chicago. We're here with one of our oldest patients, Kelly.
Long term, maybe
Long
not oldest.
not, yes, exactly. Kelly, do you want to tell all the viewers on YouTube when you came to see us, why you came to see us, how you've been feeling, functioning with chiropractic care in your life, and then we'll get you going with an adjustment.
Sure. I originally came because of a lot of shoulder and neck pain and tension, and then I've had chronic migraines most of my life, and so I wanted help with that as well. And I've been coming maybe 5 or 6 years. Sometimes I take a break just to, try to do it without, but I always end up coming back. And so I've been having a tough time with my migraines lately, so that's why I'm back here again.
Yeah, Kelly came in, chronic migraine sufferer since she was early teens, under care from a neurologist. You name a pill, she'd taken it and or was taking it, and it was literally managing at best the symptoms right. Migraines were still real chronic, real severe, really affecting Kelly's just ability to function day to day. Came in with us, did a full corrective care program, changed her life. Yeah, minimal migraine, she just functions so much better with chiropractic care. So Kelly is on a mini corrective care plan right now. She took a little bit of a gap with some travel. She pushed back to Chicago, so she's back at it a couple of times a week to get back on top of those subluxations. So Kelly, let's get you adjusted. You want to lay chest down. All right guys, so if you watched our videos on YouTube, you know that we use the ortho-stim. This has so many benefits. Fires up muscle spindles in muscles and joints, helps pick up on proprioception, helps hydrate discs. And then before we adjust Kelly, we're going to just essentially get Kelly going with some soft tissue treatment. This is the Hypervolt A massage gun. We love the Hypervolt, great brand. Kelly gets a massive amount of stress and tension, which manifests in her upper back, tickling these traps. It's coming from a forward head shift, lack of curve in her neck, and then just being stressed out. So what we're doing here with the Hypervolt is just using the percussive tool to help break down just tension that's sitting in the upper head of this trap through a common structure we see and treat in the practice. And we're just going to spend several minutes just working through this tissue. I've got the trap in my hand and the Hypervolt's just kneading it out. If you have tight traps, it's a great way for you to kind of be proactively managing them. A Theragun has a triangle handle where you can cock it over the back of your shoulder. We're going to get into kind of the erectors down this QL before we got going with the adjustment. Kelly's saying she's having some low back pain on the in this QL region. So we love to use the Hypervolt just to warm the spine up. We'll do this bilaterally. Alrighty, so we're giving that tissue some love. Got some blood and oxygen in there. Now we're going to adjust the thoracic spine in case we subseen our upper thoracics today. Nice job. There we go. We've come right into this TL junction. Good. Okay, Kelly's hips adjusted. She was to shift in her right hip. You see that hips come up and across. We like to use the drop piece here. You check Kelly's sacrum today. Keep your right leg straight, Kelly. Raise it up for me. Down, left side, down. A little bit of rotation in that tailbone. We're going to address that. Good. Release that shoulder. There we go. Good. Kelly's moving great today. Lay on your left hip, Kelly. Nice job. That moved on setup. And then, as Kelly explained in her video, or the beginning of the adjustment, Kelly, chronic migraine sufferer, you've got tiny muscles that anchor the skull occiput, which is the base of your skull right here, into the top two vertebrae, C1, cervical 1, cervical 2, called the atlas and the axis. Essentially, these muscles rotate your head. And when we have poor posture, traumas, Kelly's had plenty of trauma, and some postural changes from those traumas. They get full up of adhesion. Adhesion is weak fibrous collagenous tissue, acts like glue in a muscle. So it's not going to allow those joints to articulate well. They're going to subluxate. Subluxation creates stress on the nervous system. And for Kelly, that manifests as headaches, migraines, changing the sympathetic nervous system, that fight or flight response. So we're just taking this tissue through range of motion. It's under tension. I'll break down that muscle adhesion. You allow those joints to move better. When we get Kelly's neck adjusted, the adjustment to stick and hold. Give me a little bit of flexion in here.
Will you do the TMJ too?
Absolutely.
Awesome.
And we go in outside and inside, or just
No, it
outside?
is outside. That's probably fine.
Got it. All right, so we now going to adjust Kelly's upper cervical spine. I'm going to come over to the right. How you adjust this joint's a little different. Let's relax. Good. Come under C2. Nice job. Then we're going to do a little bit of work in Kelly's jaw. She suffers with TMJ, temporomandibular joint pain. Kelly's going to open her mouth. Nice job. Close it. Open her mouth. Good. We're working on a pterygoid, it's a structure in the jaw, yep, that can drive a lot of pain and dysfunction. Yep. Good. Yep. Good. Yep. Good. Yep. Good, one more. Yeah. Good, nice job. All right. So we do a little sign off. Alrighty guys, if you're watching on YouTube, you're suffering with headaches, migraines, jaw pain, upper back pain, we can help you just like we're helping Kelly. If you're watching on YouTube, subscribe, turn on notification bell, Instagram, Facebook, any of the channels. Like and follow the page. Appreciate you watching. We'll see you in the next video.